Sleep-deprived nights, maxed-out credit cards, the crushing weight of responsibility for employees' livelihoods. Dr. Tony Jacob weathered them all while building what would become the largest private optometry network ever sold in Texas. Yet beneath this headline achievement lurks a series of harrowing challenges rarely discussed in entrepreneurial circles. Struggles that expose the profound gap between medical education and business reality. Ocular disease? Certainly. Contact lens fitting? Absolutely. Negotiating commercial leases or creating cash flow projections? Medical school curricula skip these entirely. Dr. Tony Jacob discovered this gap when he purchased a building in Lockhart, Texas, initially planning it as a real estate investment rather than a practice location. What began as a property investment unexpectedly evolved into the cornerstone of his healthcare enterprise. When Tony opened his first clinic in that building in May 2010, he suddenly confronted responsibilities wildly beyond his medical training. Responsibilities ranging from staff recruitment to marketing strategy, equipment financing to regulatory compliance. Most medical practitioners view their clinical expertise as their career ceiling, but Tony saw his optometric skills as merely one component of broader entrepreneurial ambitions. Without formal business education, he learned entrepreneurship through costly mistakes, a painful educational process many colleagues avoid by sticking with established practices or hospital systems. Revenue growth masks cash flow disasters. Dr. Tony Jacob learned this lesson painfully after expanding from his successful Lockhart practice to a second location in Kyle, Texas. Despite strong patient numbers, the financial machinery behind a multi-location operation nearly collapsed under its own complexity. Healthcare ventures demand extraordinary capital investment. Diagnostic equipment can run into hundreds of thousands of dollars, while office build-outs must meet specialized medical requirements. These factors created dangerous financial gaps threatening the entire operation. Casual observers might notice only expanding clinic locations without seeing the financial high-wire act happening behind the scenes. Tony's experience reveals how conventional business metrics often fail to capture the unique financial rhythms of healthcare enterprises, where revenue growth can paradoxically increase cash flow pressure rather than relieve it. Dr. Tony Jacob never imagined his biggest professional challenge would involve abandoning direct patient care. Yet that's exactly what scaling his practice network demanded. A psychological transformation as difficult as any operational hurdle he faced. Each new location added layers of responsibility, gradually forcing Tony away from clinical work toward executive functions. Moving from hands-on care to strategic leadership required not only different skills, but also a fundamental reimagining of his professional identity and sources of satisfaction. By 2017, Tony had fully embraced his CEO identity, a psychological evolution equally challenging as the operational aspects of scaling his business. Learning to derive fulfillment from organizational achievements rather than individual patient outcomes represented a profound shift rarely acknowledged in healthcare entrepreneurship conversations.